Welcome to Acuity plus Acumen Season 2, where we illuminate leadership and inspire change. I'm your host, Deanna Armstrong, and today we are honored to host Clorinda Walley, President and ex-officio board member of Good Days, a national nonprofit organization dedicated to lifting the burdens of chronic disease. Welcome to the show, Clorinda.
Thank you for having me.
Thank you for coming. I really greatly appreciate you taking the time to sit here with us today. So let's get started. Help our audience get to know who you are. So can you tell us a little about yourself?
Sure. I'm Clorinda Walley, president of Good Days, which is a national nonprofit organization. And we're dedicated to removing barriers to care. Fundamentally, what we do is we provide financial assistance to individuals who can't afford their treatment or can't afford to get to and from their treatments. We'll also provide assistance for premium assistance as well as diagnostic testing.
So what is premium assistance?
When individuals can't afford their healthcare premiums.
Oh, okay. Got it.
And so, with all of those keys, we're removing one barrier to the next. So if you don't have health insurance or you can't afford it, the pathway to get to a provider is almost non-existent. And so we try to remove barriers as we find them through the community that we work with.
Okay, fantastic. So I'm the ruler of the board again, so learning more about Good Days. But Clorinda, what does leadership mean to you, and how would you describe your leadership style?
It's an interesting question because my leadership style has changed over the years. From becoming a young leader to where I am at now, I've learned a lot. And I think the biggest key to that was having the opportunity to fail. The chance to succeed, but the opportunity to fail. And why that is important is because I've learned more from what I did wrong than from what I did right.
Yes.
And I've been fortunate to be in an environment throughout my career to have the opportunity to fail, to learn from those things, to reflect and say, what would I do differently? Would I do something differently?
Right.
And what would the outcomes have been? And I think that is my leadership style, is providing an environment for the people that work with me, is giving them the opportunity to fail. And it's a soft failure. You start with low risk. Because what you don't want is leaders who are adverse to risk, because then you go nowhere.
Because it's that innovation piece that comes with that failure, that thinking outside of the box, right?
Oh, absolutely.
Yeah.
And learning from that. And it opens up your horizons to see, did I include the right people?
Yes.
Was everyone informed? Did I not only look at the impact of change forward, did I look what it would do behind? And so I think that, that's really important. And, another key is surrounding yourself with people that are better than you are. And so I've surrounded myself, and I've been fortunate to surround myself with people who have qualities that I do not, that are able to point out if they think something's going in the wrong direction. And the way that you get there is through trust and through providing opportunities.
And I think that's very important, because you don't want a lot of clones.
No,
right?
I do not.
You want those people to, like you said, to fill in those gaps and to bring that cognitive diversity so that you can continue to see problems from different perspectives.
Oh, 100%. Like, if you're looking at a problem, you're looking at it from this point of view. But when you bring in other people, they're going to show you an angle that you might not have seen. And so, I find it important anytime at Good Days when we're looking to make change, ensuring that every department is involved. Because one small change can have an impact on a team that you didn't recognize.
Exactly. That collaboration and having all the right people have a seat at the table.
Absolutely.
That's visionary, like visionary leadership right there. And I know that you've worked in nonprofit and for-profit.
Yes.
Did your leadership style or approach morph depending upon which environment you were in?
So it did change a little, and I would say less because of the environment, but because of growth.
Okay.
And when
personal growth?
Personal growth,
okay,
definitely.
Okay.
So when you're like in the for-profit space that I was in, you're always looking at bottom line, cutting costs. Those are big focuses, especially when you're dealing with operations. And you also have to take consideration the impact it's going to have on your consumer, or the end product, without causing an impact to the outside audience.
Yes.
One of the things that I think has changed with Good Days is truly understanding the need of the people where they're at. Not where I think they're at, not what I think they need.
But meeting them where they are.
Asking the right questions.
Asking the right questions.
And I learned, I was diagnosed with an autoimmune disease when I was probably around 36. Prior to that, I believed I knew what the patient needed. I was truly convinced I did.
Okay.
I've got this operation down. These are the things that they need. These are the things that we're going to provide. But once you're in it, and it's you have a brand new perspective of the reality of the everyday situation of somebody struggling with a chronic or life-altering disease.
So knowing that you had that insight, what are some of the things you're doing to make sure that other folks on your team are seeing the patients from a different perspective as well? Because they may think, I already know. I already know.
And so one of the things that we do, and so let's just say that we're going to work with people who've been diagnosed with multiple sclerosis. We bring in a team of medical professionals that go through, what this diagnosis does to a patient's body. Then we'll bring psychosocial support in to say these are the emotional impacts that this is going to have on the individual. And not only the individual, but on the family, on the caregivers, on their job. And so, that really brings insight to understand what the full picture is, and not just what I believed it was, which was getting the patient on therapy. It's far greater than that.
That's interesting. The whole person.
The whole person.
The whole person, the whole patient and their journey. And I would think that empathy plays a big role in the type of work that you do.
Absolutely. Empathy, sympathy, and then compassion.
So what's the difference between those?
So empathy in my perspective is understanding the journey the person is on. Sympathy is feeling bad for the journey the person is on. Compassion is combining those things and doing something about it.
Action oriented.
Action oriented.
So considering that empathy, sympathy, and compassion, what role does that play into you creating a vision for your team and where you want to go in 2025 and beyond?
Oh, certainly. Education is very important, and preparing someone who's taking those calls to the story that they're going to hear. Every call we get, it's emotional. You have people who are suffering who, we might be the 5th, 6th, 7th call they've made to try to get help. And meeting them where they are and truly listening without wanting to respond. And it's important because they could be diagnosed with a late stage cancer. And the amount of time they have to live might be 6 to 18 months. The person you're speaking with can go through a range of emotions: sadness, anger, like why me, not understanding what to do next. And it's important that the person taking that call has all the tools they need to listen, to understand, to show compassion. And even if it's not us, is there other advocacy groups we work with that could provide the support that this person or this family needs?
I think that's great information. How do you train your staff to be able to interact with your patients in that way?
So one of the first classes that we all go through, and we do this every year, is called motivational interviewing. And what that teaches is, one, how to listen, and really how to gain the trust of the person that you're speaking with. So then you can get to the true need. Because many times when people are calling us, they're like, I really don't want charity. And what we tell them is, you were brought to us for a reason, and it's not charity. It's called compassion and wanting to help.
Yes.
And what motivational interviewing does for the people who are speaking to the patients is gives them the opportunity to gain further insight to the true needs of the individual. So they might be calling and needing financial assistance, for example, to pay for their treatments. But as you start speaking with them, you might also find out that they're struggling emotionally. And maybe psychosocial support
So
could
like
help.
wraparound
Yeah, and
service,
so
the whole person.
absolutely,
Again. Okay.
learning who they are, and then letting them know these are all the resources that are available. Would you be interested in us connecting you with those?
Oh, that's fan. You said motivational
Motivational interviewing.
I need to learn
And
that skill.
it's a lot of about emotional intelligence and listening before speaking, truly understanding the person before you try to give them a solution.
And I think that's important as we're into this machine learning or a generative AI world, that those are the skills that are so important, the listening skills, the empathy that people need to have, and that being self-aware. So I think that's fantastic that you're training your team on that, and they'll just continue to be impactful for years to come.
Oh, 100%.
And as you talk about the great things you're doing and those wraparound services with patients, it makes me want to know more about Good Days. So can you help us understand what exactly is Good Days? What is your mission, and what do you do?
Absolutely. So again, at the base level, our mission is to remove barriers to care. But what exactly does that mean? And for every person, it can mean something different. Some of it is financial. Removing the financial burden so they can get the care. The other piece of that is psychosocial support, caregiver support, travel support, getting an individual to and from. So then you get the diagnosis, you have a treatment available, but some of these treatments might take 6 weeks that you're going to have to be near the hospital in which you're getting treated, which is probably not in the state that you're in. And so we will cover accommodations.
Okay.
And work with the provider's office to make sure that the individual gets to and from treatment. We work with Uber Health, Lyft Health to ensure that they can, the driver understand the needs of the individuals that you're putting in their transportation, and ensuring trust and getting them to and from where they need to go.
I didn't even know that existed.
Yeah,
Uber Health and Lyft Health. That's
it's trained drivers who have an understanding of the need of people who have disability or chronic disease.
And that's good to know. My brother is my brother is blind. That's something that now I'm thinking about. He can utilize.
Absolutely.
I know he uses taxis, but I don't know if we knew about the Lyft health part of it. So thank you for sharing that.
Absolutely.
And it sounds like you're addressing a lot of the social determinants of health. The transportation, the financial piece. How about the food insecurity part?
And that's kind of our next step.
Okay.
And so what you're finding is another arm of Good Days is something that we started about 10 years ago. It's called Chronic Disease Day. And it's on 7/10. And the relevance to that is because 7 out of the top deaths annually in the United States are due to preventable chronic disease.
Wow.
And a lot of that is cultural, because as you've seen in the pandemic, when COVID struck, who did it hit the hardest? People of color,
Right.
Hispanics, African Americans, Native Americans. And why? Because the instance of chronic disease is far greater in these populations. And so, I have a big drive and desire to change that, to address the causes of obesity, type 2 diabetes, heart disease. And a lot of that is through food insecurities.
Yes.
Education on the impact of diet and exercise on the trajectory of your life.
You know what's interesting? We were moving from what my niece would call Pleasantville. I don't know if you ever saw that movie where they were all in black and white, and then when they started becoming worldly, they started to turn to see in color.
Yeah.
And my niece would always say that's where we lived, in Pleasantville. Well, we moved into the city. And my mother said, "Why are you moving from Pleasantville to the city?" I'm like, "What are you talking about?" She said, "They take the grocery carts from your neighborhood and give them to the ones in the neighborhood where you're moving." I thought, she's so silly. That's so, like, really? But with the pandemic, I realized, and we moved right before the pandemic, unfortunately. It was crazy. But it's true. Every time I would go back to my old neighborhood to a store, they had new carts. But when I would come to my neighborhood, it was the old rickety carts that they would have. But that's just the systemic way that you see things happening in those food deserts. Mm-hmm. And not only that, I had another friend whose mom had cancer, and my kids said, "Let's go make her a smoothie." I said we would go get the frozen fruit from their grocery store by their house. It was very limited.
Didn't exist.
Right. Basically, yeah. I think we had strawberries and bananas. That was it.
And so again, those are unfortunate.
Yes.
You know, it's one thing to have a need, but then know where to get it. And so, you know, we have to meet again where the person or the individual is, where that community is.
Yes.
And again, truly understanding the need. And some of it could be education. Others could be lack of access. And
Yes.
those things have to change. Again, this is the first time that I am aware of in our lifetimes that our children have a projected lower lifespan than we do. And again, it's due to diet and exercise. And so what are we doing as a country to address those needs? And that is something that Good Days would truly like to do, community by community. Because again, I am not in the, you know, one thing fits all.
Right.
You have to first truly understand the needs by having roundtables, by listening to the community, and then by bringing in programs that they're involved in for the success of it, not only for the operation, but for the people that we're serving.
Yes. And you're national.
Yes, we are.
How do people find you?
Well, most of the categories in which we help are highly costly treatments that need people who specialize in those things.
Okay.
And you know, we were founded in 2003. I started with the organization in 2007. So, you know, we work with hospital systems across the country, specialty pharmacies in which you're going to find these treatments. If you're diagnosed with non-small cell lung cancer, you can't go into your local CVS or Walgreens and get the treatment. You're going to have to go to a specialty pharmacy because, again, the treatments are highly specialized.
Yes.
They have to be monitored and followed by a clinician. And so we work with all of these entities across the country to provide access, if we have it, to those financial needs of the individuals.
That's awesome. I think we were just talking earlier with another group. They were talking about the importance of access to health care for patients. And it's nice to see that you have a solution there.
Mm-hmm. And we kind of look at ourselves as a safety net. So indigents, that you have Medicaid. Lower middle class, you don't qualify for Medicaid, but you can't afford anything outside of that. And you know, our desire is to catch that group of people who have need. You know, the productive members of society, you know, going to work. If you can't get treatment, you can't access it, how are you going to be able to function and go to work?
Exactly.
You have multiple sclerosis and you can't afford the treatment. Your disease progresses. And even if you start treatment, it's very unlikely that you're going to get back to where you started. And so now you're starting at a new endpoint. And so it's important for these people to have access to these
Yes.
treatments, especially when the average person that we help makes about $39,000 a year. Try coming out $2,000 out of pocket every month. You're on the street.
Yes.
And
Real
you know,
fast.
we
Or you're not eating. Right. If you
you've got to
get the
sacrifice
medication,
something.
You're sacrifice. Right. Exactly.
And you know, we don't want anyone to ever have to make the choice between everyday necessities, food, water, housing, and treatment.
And when the person enrolls in your program, do you follow them through?
Yes.
For-
And so we, our assistance is a calendar year.
Okay.
So from January to December.
Okay.
And so long as funding is available, we'll re-enroll. We've been serving some of the same patients for 15 years,
Wow.
year after year. You said your brother was blind. Well, some of the programs we have are for blindness, or especially in elderly, macular degeneration. Without treatment, they will go blind. And you know, again, looking at costs, these treatments are about $300 to $600 a month after insurance. And again, $39,000 a year, you're giving something up.
Yes.
And it's either going to be your eyesight or everyday necessities.
Right. That's something, right? What a choice to have to make.
It's horrible.
Yeah.
You know, and part of what made me want to transition from for-profit to nonprofit, in my for-profit, I worked for what is now Walgreens Specialty.
Okay.
And, you know, we were on the side of, you know, we received your prescription from your provider. It's going to be $4,000. Well, was insurance involved? Yes, this is after insurance. How devastating is that?
Yeah, that's a big pill to swallow, literally.
And then, you know, I don't know how many times people walked away from treatment because they couldn't afford it. And so being on this other end, I have an opportunity to say, I can help. We can help. And if we can't help, we work with over 24 national nonprofits across the country to try to close those barriers and introduce them to someone else. And even if they're looking for, let's say, support for their treatment, if that doesn't exist, there could be programs that help with their travel or that can offset the electricity bill, some way to offset costs so the individual can get treatment.
So I can only imagine what patients say, but sometimes you said the patients are a little hesitant when they call in because they don't want to seem like they're reaching out for charity. But once they are enrolled and they reap the benefits of the program, what kind of feedback have you all gotten?
We get letters on a daily basis where people are calling in or sending in mail that will tell us, if it wasn't for you, at this stage in the progression of my disease, I'd be blind. Or I have a letter that I brought, if you don't mind me reading it.
Oh, please do.
Okay, so forgive me for bringing this up on my phone, but this is how powerful and the impact that what we do and charities like us do for people. And so this is a letter. About 14 years ago, my mother was diagnosed with stage 4 melanoma. Due to the help my parents were able to receive through Good Days, she was able to receive the exceptional care she needed. We were so grateful to be given 5 bonus years with her. In these years, we enjoyed Christmases, birthdays, and many special times together, including some of her grandchildren's high school graduations, as well as getting to know and love her future grandson-in-law. Thank you so much for all you do to help people in their most trying times. My father found relief and extended time with my mom. Thanks to Good Days.
Oh, that's wonderful.
And this is the reality.
Yes.
And the thing that keeps me up at night is the families that we can't help. And we're in a position in this country to have the ability to make change to help people. And so another part of what Chronic Disease Day does is we look at legislation. What's going to come out that's going to impact the chronic disease community? Is it going to be good or is it going to be bad? And it is our job and the coalition that we created with all these, very large advocacy groups, American Heart Association, Liver Foundation, Leukemia Lymphoma Society, to go to these legislators, whether it's Congress or Senate, and say, if this passes, this is the impact it's going to have on the chronic disease community, which is large. Or if this doesn't pass, this is the negative effect it's going to have. And so we're continually through this coalition looking at what exists and what's being proposed to see what is the outcome it's going to have on these people who have great need.
So what are some of the things our viewers and listeners can do to get involved in Chronic Disease Day and initiatives like the coalition?
Absolutely. Go to our website. It's chronicdiseaseday.org or cdday.org. And there's many things you can do. You can sign on to letters to legislation to talk about you support this pending legislation or you don't support something. And we're very good on this website of kind of spelling out what it means.
Do you give us form letters?
Yes.
Perfect.
And if you want to sign on, another thing we do is Chronic Disease Day is recognized in over 40 states. And if you see a state on there that you're from that isn't on our list of recognition, then send us an email, send us a letter, reach out to us, so then we can go to that state and say, we have constituents of yours that would like this recognized. And again, what this does, really the foundation is removing barriers for people who are struggling.
I love that. With all types of chronic diseases, so not just one specific.
It goes from chronic disease, cancer, life-altering disease. We help with cell and gene therapies that could actually be cures. We help with HIV, non-small lung cancer, macular degeneration, retinal vein occlusion. So a long list of different categories, whether it's affecting young children
that's a good point.
or the elderly.
Yes. Okay, because we talked about the elderly, but so even little kids or like infants that may be born with it. Okay.
So there's spinal muscular atrophy is a program that we help. Prior to these new cell and gene treatments that have come about, the lifespan of these children might be 5 years. Well, this cell and gene modifies the makeup of the child to where essentially the disease is gone.
Wow.
Essentially a cure.
Fantastic.
The problem is
It's
cost.
expensive. Yeah.
And so, we help in this program with copay assistance, with travel assistance, and premium assistance to ensure that that child, and generally, they're diagnosed within 6 months from birth.
And I know one of the things you mentioned as far as a patient population was people of color.
Yes.
What are some of the things you're doing to ensure that your program services are actually reaching the communities that you would like to, that you're passionate
Absolutely.
about? Right?
And so, I'm glad you said that. So we work with different hospitals. And, when I talk about coming to the community and learning, we started working with UTRGV in Rio Grande Valley.
Okay.
And so, this has the highest population of cervical cancer in women. And, it's a large Hispanic population. And so really diving into, is it education? Is it access? And really that's what we're trying to do. So hospitals across the country in Atlanta, working there to gain an understanding of what does the community need? Where is the system failing? And what can we do to address it? Okay. And it's definitely by community. This isn't a one version fits all. And you start from one community, find successes and move them on and learn from what didn't. Right, 100%.
Right, replicate it. Don't reinvent the wheel.
No,
yes,
and
yes.
We were at the Morehouse School of Medicine specifically for Chronic Disease Day to gain an understanding of what does the community need, what does the African American community, the Black community, the Hispanic community, what is missing, and what are the driving factors, and what can we do to affect positive change.
So what are you doing with the data that you capture? Just curious.
So we look to create programs. So any information we receive, we don't. It's not. We're not publicizing it. Okay. If I'm working with Morehouse, for example, we work in aggregate. Okay. So there's let's just say this many families impacted by food deserts, or this many communities. So we look at those numbers and say, okay, if we were to build a program, what is the cost? And what is going to have the most impact? And so in all of the data that we're looking at, it's all in aggregate without any identifiable information. Right, so we can figure out what to do on how to help the community. And we also bring community members and say, okay, let's talk about it. What are the needs? What are you hearing? And how can it be addressed? And it's certainly something we don't do alone. And it takes a community, a village, and the village is the United States.
The village is what?
The United States. It's everyone.
It's everyone.
Everyone.
We're all a part of this village.
100%.
All of us.
And
everyone.
It's, the desire to create the coalition is because with more voices, the louder we are, the more we're heard.
The louder we are, the more we're heard. Right? Mm-hmm. And closed mouths don't get fed. All of those
100%. Yeah.
Yes.
And, again, it has to be a diverse group. I can't speak for something that I've not lived. And so you have to ensure that everyone is coming to the table and educating. We're educating each other.
Yes.
And then coming up with a solution that might be changed. Best laid plans, but you have to be nimble enough to modify to ensure that you truly do have impact.
Yes, yes. Very important. Very important. And to continue to have the patient voice. We talked about medications that have been approved and all of that. Are you working with the other side of the arm, with the research and development piece, with the clinical trials and supporting and providing support for patients that may be a part of that? Because I know that's a gap too.
It is.
One of the things is that oftentimes those clinical trials are in the ivory towers of the world, and so rural communities can't necessarily get access to it, or those social determinants of health that you address, like the accommodations and the...
Yeah, so it's one thing to have a trial, but if you can't get to it, even if you're approved,
right,
and if you have transportation issues, the access has just been taken away.
Exactly.
And so we do look to address those things. Good Days personally does not. We don't personally fund trials or things like that. However, again, working with all these different groups, if somebody comes to us and they're looking for information, let's just say it's within oncology. we're going to refer them and speak with cancer support community or cancer care. So they will be in the hands of the experts that can provide them, proper guidance on where to go or what to enroll in.
Okay, awesome. And I'm sure there are a lot of programs like Good Days.
There are. There are probably about 5 other organizations that provide similar services that Good Days does, and we all work together. If I don't have a program, they may. And so, we work hand in hand to ensure that the person we're speaking with does not get lost.
Awesome. I was going to ask, so what differentiates you from the other programs?
I believe it's our compassion. Everyone that works for Good Days is in our office. We don't outsource anything, and it has to do with culture. And every individual in this organization can take a phone call from somebody calling in to enroll. Every one of us is invested to ensure that every time we want to make change or we propose change, we understand what it's like sitting in that seat and how it's going to affect the people. So I think our biggest differentiator is the people who work for Good Days. And it's the compassion that drives our desire to help.
Amazing. When you think about your strategic imperatives for 2025 and maybe the next 5 or so years, what are the top 3 things that you and your team are looking at?
Again, we're going to be focused strongly on food deserts and looking to ensure that people who are having financial struggles in food deserts or are struggling to make ends meet because they're making their low income or barely getting by, ensuring that we can make efforts to give them a better life. Another piece of that is looking at chronic disease, providing education and programs that can help change the lives of our communities. And something I'm really interested in, I really do think it's going to change. People talk about personalized medicine.
Yes.
We've not really got there. Right. But what I think cell and gene therapy is doing is personalized medicine. They're looking at your DNA, your outcomes, your history.
Yes.
And what I'm hoping is, instead of looking at treatments, we're looking at cures.
Cures and maybe even prevention.
And
a lot of the
prevention,
vaccines,
100%.
all of that too. I
So
love that.
a part of Chronic Disease Day is looking at what can we do from a prevention perspective, and for those diagnoses that are genetic, that it doesn't make a difference what you do or what you change. What can we do from a science perspective to bring cures instead of treatments?
That's a tall order.
It is,
right?
but I think we've never been in better position, and I think North Texas has a real opportunity with what's taking place here to take the lead on some of those.
So talk to me about this blooming biotech life sciences sector here in North Texas. What are your thoughts about the strengths of the region and some of the opportunities that we have and some of the challenges that we may have here?
Well, I think, starting with challenge is, convincing, these large pharmaceutical and research companies to come to Texas. The second thing is going to be having an environment that embraces it. I think that Bio North Texas has done a really good job of bringing together people from science, people from advocacy. They're really looking to create a round table that is a reflection of the community.
Yes.
And understanding what those needs are, working with the local hospital systems. And I think that those will drive change and bring things to North Texas.
Those challenges and also the opportunities, right?
Oh, yes.
And what do you think makes us strong? Why Dallas, Fort Worth, Frisco, North Texas versus the East Coast or West Coast? Or is it an or is it an and?
Well, I think there's a couple of pieces to it. One, just if you look at cost, West Coast and East Coast, it's very expensive. Inflation rates, how it impacted us, it was even more impactful when something's already expensive. Just looking at land opportunity taxes, there's a lot of incentive to move here. We have a lot of land and a lot of opportunity for corporations to come here. And it does a couple of things. It strengthens our economy in Texas, provides jobs. And again, it provides opportunity for all of these local colleges who have recent graduates to find a place in life sciences.
Yes, because we have that education piece here, and we don't want them to move.
No.
We want them to stay
Yes,
here and to
absolutely.
give them meaningful work while they're here in their area of expertise. Yeah, I think you're onto something. I think it's a great time to be in North Texas, a great time to be a part of that life sciences ecosystem, and the collaboration that you see in the region is impressive.
It is,
It's
and
impressive.
I'm happy to be involved, and I think we're also doing a lot on women in science, and coming together as a group of individuals, women with different backgrounds, to learn from each other, and to raise each other up.
Yes.
And I think it's a good community to learn and grow.
Yes, I agree. And speaking of women in science, as a woman in science, Latina
I'm Spanish and Navajo.
and Indigenous, what drove you to be in this type of sector, and what advice would you have for a young girl who's Indigenous or young girl who's Latina, or like you, a combination?
I think I started, and this is a silly story, but I started working at Eckerd Pharmacy when I was 15 years old.
Does that still exist?
It does not.
That's
It's
CVS now, right?
Yes.
Okay, yes.
And so I was in a job program at school, and I lived in an apartment that was like behind where Eckerd was. And so one day I was walking in there and I was wanting to buy gum. And I go to the back because the line in the front was too long, and there was a sign that said, pharmacy technician for hire. And so I went up to the pharmacist, again, 15 years old. You didn't have to be licensed back then, just FYI. And so I was like, I would like to have that job. And he said, why would I hire you? And I said, because I'll be the best employee you've ever had.
Wow.
I started the following week. But the biggest key is confidence, and don't believe that everyone is smarter than you are. Work hard.
Yes.
And be willing to do anything.
Yes.
There wasn't in any position I've ever been in that I wasn't willing to, go clean the bathroom if that was needed, answer a phone, or make a decision. And so
Make a decision is being decisive is a skill.
And so, the best advice I could give is understand in any company you're working for, and I don't care if it's from, the ground level, know everything about that company, what it does in every department. And that's going to give you a strength that many people won't have. When you're walking into an interview, even an interview in the company that you're working for, and you truly understand every department, that's huge.
Yes.
And to me, it's about empowering yourself. Taking opportunity even when you're not being paid for it. When somebody says, hey, do you think you can do this? I have always looked at that as an opportunity to learn where somebody's paying me.
And we're coming toward the close of our time. Yes. Is there anything that you wanted to cover that we have not covered yet?
Yeah, I just want to say thank you again for having me here. Never be afraid to collaborate. Surround yourself with people who are smarter than you. You've got so much to learn. And the moment you stop learning, or you stop believing you've learned enough, that's where it ends for you. And so, as far as Good Days, I welcome everyone to go to our site and learn what we do. There's never enough dollars to help those in need. And so, we take donations in various ways, whether it's financial, or wanting to partner with us to spread word or provide educational materials so we can hand out to the people that we serve. So again, thank you for having us here.
Oh, you're welcome. And my last question is, when you think about the biotech life sciences ecosystem developing here in Texas, 10 years from now, when you look back, what would you like for people to say, this is Clorinda's impact on where we are today?
I think what would be most impactful for me is to see the people that I work with and the people that work for me elevate themselves. Every person that works for me, I hope one day they go somewhere else in which the skills they learned will be a key to their future leadership opportunities. Yeah. And I think, the other impact that I hope we have as an organization, myself, is providing more good days to the lives of the people we serve.
I love that. I never thought about that. You're providing good days. Well, thank you again for being on the show. I really appreciate you and the great work that you and your team are doing to help patients with chronic diseases all over the country. And looking forward to seeing you grow. And when is Chronic Illness Day? July 10th?
July 10th.
7/10, right?
7/10.
7 out of every 10 patients with chronic.
7 out of the top 10
So
deaths
top 10 deaths.
annually in the United States are due to chronic illness, and the majority of those are preventable.
Preventable. It's all about prevention.
Yes,
So
and
thank you.
you know, one desire, change the number. I would love it to be 6 out of 10, 5 out of 10, 4 out of 10.
Me too. I'm joining you on that bandwagon.
All right.
So thanks again for coming. And thank you to our listeners and to our viewers for watching this episode of Acuity plus Acumen with Clorinda Walley. We heard her personal story of resilience and learned about the vital work of Good Days in supporting patients with chronic diseases. As president of Good Days, Clorinda's leadership and courage in sharing her journey and her unwavering dedication lifting the burdens of illness offer a powerful message of hope and the importance of compassion in healthcare. Thank you again, Clorinda, for sharing your vulnerability and your passion with us. To learn more about Good Days and how you can contribute to their mission, visit their website at mygooddays.org. Your support can make a significant difference in the lives of people in need. And if you enjoyed this episode, please consider subscribing, sharing, and leaving a review. Your engagement helps us bring more inspiring conversations to listeners like you. Until the next time, I'm Deanna Armstrong, and this is Acuity plus Acumen.